So this is the second portion of the male reproductive lecture. If you guys hear dogs in the background, I apologize as I'm working from home. Um, let's see where we stopped last time. We'll start here with the with the sperm. So we talked about the head, midpiece, and tail. Again, the head is going to be an important part. There's something called the acrosome, and the acrosome is going to contain the digestive enzymes responsible for penetration of the oocyte. The neck is going to be responsible for movement. Remember, the neck has the microtubules which are present. The mid piece has an M in it for mitochondria, and again, the mitochondria is going to be responsible for providing the energy for the motility of the sperm itself. And again, the end piece, this is just the terminal tail. So here is the reproductive duct system in males. And this is the ducts of the testes. This is just a pressure system which allows movement of the sperm. What I, again, want to reiterate to you guys is the mnemonic that I told you guys about in class. Seminiferous tubules, epididymis, vas deferens, ejaculatory duct, nothing, urethra, and then the penis. So going back to this, again, it's no surprise to you that this is going to be the route of sperm travel. Of note, something that is important is the epididymis. The epididymis is going to be actually the site of sperm maturation. If you guys remember from the previous slides, we talked about the maturation of the sperm, how from the primary spermatocyte to the secondary spermatocyte, we went from a diploid state, having 46 chromosomes, to a 23 end state, or a haploid state. From there, from the primary spermatocyte, we then went on to form the spermatozoon, which again is the most mature form of the sperm. And during the sperm maturation stage, this is where they acquire motility and have the ability to fertilize. So again, just to note what I think is important from this slide is just to know that the epididymis is the site of sperm maturation. Also, which is important, if you remember our mnemonic from the epididymis, you continue on to the vas deferens and that 7-up mnemonic. So the vas deferens, this is going to be responsible for providing movement of the sperm through something called peristaltic contractions. This just means rhythmic contractions, which is going to provide movement of the sperm throughout this duct system. So again, seminiferous tubules is where the sperm are going to be produced by the Sertoli cells lining them. They do this in response to FSH. From there, they're going to go on to the epididymis. This is where sperm maturation occurs, right? They acquire the ability to become motile and eventually fertilize an oocyte. From there, from the epididymis, they're going to go to the V, which is the what? That's right, the vas deferens, right? They go through the vas deferens. And from there, the vas deferens is just going to provide this rhythmic contraction, this peristaltic contraction, in order to move the sperm on through the duct system. So from the vas deferens, it's going to continue on into something called the ejaculatory duct, and we'll discuss that later on. This is a cross-section, which I've previously discussed both in lecture and I believe within the lecture preview itself. But here, this is a cross-section. You can see that this is most likely a coronal section, dividing it into an anterior-posterior portion. But what I really would like to show you is here, the tunica vaginalis. Remember, this is one of the muscles that's present within the scrot, or within the testes. This is going to be the serous portion. Then you have the tunica albuginea. The tunica albuginea is this dense, irregular connective tissue. Remember, it's divided into things called septum. It has septum, which divides it into lobules. Within these lobules are going to be both the Sertoli and the Leydig cells. If you remember from previous discussion, the Sertoli cells are going to be the sperm-producing cells that respond to FSH coming from the pituitary. Then you have the Leydig cells. Remember the Leydig cells, they respond to LH, Leydig for L, and the LH for luteinizing hormone. And it's primarily responsible for producing androgens, such as testosterone, androstenedione, things like that. If you guys can remember from the previous picture, you saw a picture of a scrotum with, or of the testes without the scrotum. You saw the epididymis was sitting on top. This is a cross section of an epididymis. Here within the epididymis, you're able to see some of the efferent ducts, which is going to be responsible for then moving the sperm onto the vas deferens. This is the ductus vas deferens, and again, this is just a continuation of the epididymis. What is not pictured here is the ejaculatory duct, and again, you would know the ejaculatory duct because it's just a continuation of that vas deferens. Of note, the spermatic cord up here in the superior portion of the cross section, this is going to be an important structure because it contains so many different um, vascular um, vascular supply. It contains the testicular artery, which is going to bring blood to the testy itself. It's also going to contain something called the pampiniform plexus. And what this is this is just a plexus of venules, which is going to be responsible for venous drainage of the testy. So you can imagine, I spoke about this in the lecture, if you took this spermatic cord and you began to twist it, this could obviously cause some pathology. This is something called a testicular torsion. This is often occurs idiopathically, just means for no reason at all or a reason that we can't really identify. This occurs oftentimes within adolescence, usually less than 12, 13 years old. It presents with left or right testicular pain. If I said that it was absent of the cremasteric reflex, would that surprise you guys? No, absolutely, it shouldn't. This should be definitely a warning sign that you can often visualize on physical exam. But the cremasteric reflex, remember, this is the physical exam maneuver where you stroke the inner thigh and it causes the cremasteric muscle to raise and lower the testy. This would be absent in somebody with a testicular torsion due to compromise of this nervous supply to the cremaster muscle. Moving on, this is again just going to talk about what we previously discussed. The spermatic cord ascends out of the scrotum. That's no surprise to you. We've talked about that. Consists of the vas deferens, which extends throughout the scrotum. What's important that I want to make note, and I mentioned this to you guys in the lecture, the testicular artery and the venous supply is present within this spermatic cord. I think that's very important to know. What would happen if the spermatic cord became twisted? Again, we've discussed this. You would compromise the testicular artery, compromise the venous blood supply. Um, uh, what do you guys think about could a spermatic cord potentially affect fertility? What do you guys think? If you answered yes, then you're absolutely correct. The spermatic cord, because it brings blood into the testes, and because the vas deferens is there, this could essentially be something called a pathological vasectomy. I might have just made that up, but think about what a vasectomy is. A vasectomy, as we discussed previously, is removal of the vas deferens or clipping off of the vas deferens. However, the urologist deems to provide this procedure. Doesn't really matter. It just means that the vas deferens is not going to provide sperm into the urethral canal. So essentially, if you compromise this vas deferens in a pathological way or a way that is not a way that we're not meant to, you could essentially affect fertility. Absolutely. Remember, the vas deferens is going to be responsible for providing this movement, these peristaltic contractions of the sperm throughout this duct system. The ejaculatory duct, again, this is just a continuation of the vas deferens. I want you guys to make note of that. This would be a very good examination question. Which of the following is true regarding the vas deferens? And the answer would be it's just a continuation of the ejaculatory duct. That makes sense. Think about our mnemonic 7-up. Seminiferous tubules, epididymis, vas deferens, and what's the E stand for? Ejaculatory duct. Excellent. The ejaculatory duct, again, this is just going to make sense. It ejects sperm and seminal vesicle secretions. Again, when you see the word seminal vesicle, I just want you to think of fluid secretion. So whenever you get sperm and a fluid secretion, this is called semen. And this is just, it's going to release semen into the urethra. And again, think about the ejaculatory duct. The N in our mnemonic is nothing, and then U is urethra. So continuing on, this shared terminal duct of the reproductive and urinary system. We have two different types of urethras. We have the prostatic urethra, which is going to be the prostatic portion of the urethra coming from the prostate, as well as the penile urethra. The penile urethra, again, this is going to be responsible for um, exiting both urine and semen as well. And this last portion of the text says ends at the external urethral orifice. I told you guys in lecture, another word for this is essentially just the pee hole, right? Um, Testicular torsion, again, you can see the picture located over here on the right. Obviously, there's been compromise of this arterial or venous supply as the testicular cord has been twisted around these vascular structures. This is a medical emergency. This is an example of a urethral injury over here on the left. This is something called a retrograde urethrogram, in which dye is injected. As you can see, filling here the bladder, coming down here to the urethra, going out here. This is a normal anatomy. This is normal anatomy. This is probably, as you can see here, this is called extravasation urethral injury. This is blood exiting a compromised urethra. This is probably a patient who has had something called a straddle injury. I don't know if you guys have watched or played Tony Hawk growing up, or if you've watched any fail videos of people trying to jump rails and then they straddle the rail. This is exactly this is one of the fears that you worry about, is potentially damaging this urethral structure. Again, this is a picture here of the reproductive anatomy. You guys have had a previous quiz on this. We'll go over just a few different things. This is the bladder. Directly inferior to the bladder is going to be the prostate. Again, we talked about how people with enlarged prostates, as you get older, the prostate will enlarge, and as the prostatic urethra is coming out, it will compress, and it'll make it difficult to initiate and start urine production. Of note, this is the rectum, directly posterior. Can you see why the digital rectal exam is a way to analyze the prostate, or be able to feel the prostate? Look at its location in relationship to the rectum. The rectum is sitting directly posterior, which makes sense anatomically as how we can check the prostate. Going on through here, through some more structures, this is again the prostatic urethra, continuing down here into the penile urethra. Once we are in the penile portion, we see the penis here, made up of the corpus cavernosum, and on the other side you would see the corpus spongiosum, a little bit deeper. This is glands of the penis, often just called the head of the penis. The foreskin is going to be the skin covering it, and this is the external urethral orifice, or just the urethral opening. Once we are down here, we see the testes. This is going to be the oval-shaped area present, which has this outer protective layer called the scrotum. And again, we know the testes is made up of two different muscles. You have the tunica albuginea, which directly covers the testes, made of this dense irregular connective tissue, divided into septum, which forms lobules. Within the lobules, it contains the Sertoli cells and then the Leydig cells as well. Sitting directly superior is going to be the epididymis. Continuing on the epididymis is something called the vas deferens, which makes sense if it's our mnemonic. This is a slide that is going to talk about a vasectomy. Whenever you have a vasectomy, essentially you are clipping off or removing, cutting the vas deferens, just depending on the urological procedure performed. Here, the fluids are still going to be secreted from your accessory sex glands, but the problem is you're not going to have any sperm. So will you produce semen? Yes. But will you produce sperm? No. The sperm will not be able to come out. Here is a reversal. There are reversals available, but what you worry about a reversal is the time from the procedure to the time of the reversal. As there is an increase in time of a reversal, as you can see here on this picture, 15 years out, the success dramatically decreases in sperm virility. I I told you in class, and again, I'm just going to reiterate it here. Whenever you hear accessory sex glands, I want you to hear, or I want you to think about the fluid portion. This is the fluid portion of the semen. Again, I told you semen is made up of sperm. The sperm comes from the duct system, and then you have the accessory sex glands, which is going to be responsible for the fluid portion of the semen. Here are going to be some different terms we're going to discuss just briefly: seminal vesicles, prostate, and the cowpers or the bulbourethral glands. This is going to be responsible for primarily producing the fluid portion of the semen. Of note, the prostate will provide some nutrients for sperm motility, for ATP. Why do we need ATP? I showed you guys in the picture within the midpiece there was a mitochondria, and if you guys can remember, the mitochondria is the powerhouse of the cell. Well, the prostate is going to provide some secretions, which is going to provide sperm motility, which is going to provide nutrients for ATP production within the mitochondria. I think that's kind of cool to think about at a subcellular level. Again, here, this is just another picture kind of depicting what we've already discussed. This is the discussion about the semen and penis. Again, semen is just a mixture of sperm and seminal fluid. It is slightly alkaline. It's most likely alkaline due to the acidic nature of the vaginal canal. The vaginal canal has a natural protective barrier, and this acidity helps break down sperm. So slightly alkaline helps it survive a little bit within the vaginal canal. Again, we previously discussed that sperm can survive between 24 and 48 hours within the vaginal canal. The penis, again, it contains the urethra, the penile portion of the urethra. This makes sense. It's the passageway for ejaculation of semen and excretion of urine. You guys know this. The body of the penis is three cylindrical masses of tissue with erectile tissue. I'll show you that on the next slide. The glands is essentially going to be the head. It's going to contain the external urethral orifice. It's going to have the foreskin that's going to be covering the glands in uncircumcised men, and the root is just the attached portion. Of note, what I want to make note to you guys, do you guys remember back in Biology 137, whenever you discussed the nervous system, we talked about sympathetic and parasympathetic nervous system. The parasympathetic nervous system was responsible for vasodilation, or enlarging the arteries, enlarging the vascular supply, right? Anytime you increase the diameter of the lumen of the blood vessels, that's going to allow blood to enter into surrounding structures. So if you increase the arterial size, the diameter, through vasodilation, vaso meaning muscular, dilating meaning make wide, so you widen the blood supply, this is going to increase blood flow to that area. And it does it through production of nitric oxide. And we discussed in lecture, I asked anybody if who takes pre-workout, and I saw a bunch of hands raise up, and I said, well, what happens? Some of you guys said, well, it gives us a pump. Why does it give us a pump? Because of this nitric oxide. This nitric oxide causes smooth muscle relaxation. It relaxes the muscles, it relaxes the arterioles, and allows dilation, allows the lumen to get bigger. This increases blood supply. Well, the parasympathetic nervous system does exactly that within the penis, which is what's responsible for the erection. So we, in med school, we come up with this mnemonic: point and shoot. Point is the parasympathetic, that means the erection. The sympathetic nervous system is responsible for actually the ejaculation itself. Kind of a cool mnemonic. And I posed this question: why does Viagra cause an erection? This is for some of you nurses, people wanting to go on into the medical field, whatever it may be. You guys will learn later on in pharmacology classes that Viagra causes increased vasodilation within the penis, and it does this through increasing nitric oxide production. This is a cross section of this is a frontal section. This is a frontal section of the penis. As you can see here directly in the midline area, this is going to be the urethral opening coming to the external urethral orifice. And again, we said on the previous slide that both sperm or semen and urine would be able to come out of this opening. And it makes sense because what's directly superior? You've got the prostate, which is going to be directly inferior to the urinary bladder. Within this is the prostatic portion of the urethra, and then we're getting into the penile portion of the urethra. Here's something called the root of the penis. Again, this is just the attached portion. It's made of the bulb, and it's made of the crus of the penis. The crus of the penis is just going to be the attachment points. Down here to the shaft or the body of the penis is the corpora cavernosa. And again, this is going to be the more lateral portion. And here, the medial portion is going to be the corpus spongiosum. Of note, you have Cowper's glands, which again is just going to be the accessory sex glands, which is going to be present up here. And this is going to be responsible for producing what? I said accessory sex gland, you should say fluid. Absolutely. Coming down here, this is going to be another section. It looks like this would be what? A coronal. This is a coronal slice showing you the different layers. We talked about the skin being directly the most superficial layer, and as you begin to cut and get more deep, you have the superficial fascia. Remember, I said fascia is just an enclosement, usually of muscle. It helps with movement. It's kind of like, remember I said if you're packing up and beginning to move, what do you use? You use bubble wrap. Bubble wrap helps to enclose, to keep things safe, helps with movement. And that's kind of what this is like. And deeper to the superficial fascia, you have the deep fascia. And again, that makes sense that we have fascia because what are we having next? Muscle. This is the tunica albuginea. We said it sets directly on the genital area itself, and it directly covers the scrotum. The corpus spongiosum is directly inferior to this tunica albuginea, a little bit deeper. More superficial, you're going to have the dorsal vein as well as the dorsal nerve and dorsal artery. This is going to be your vascular supply, supplying the penis itself. Do you guys remember what supplied the scrotum? That's right, the testicular artery. And what was its venous drainage? The pampiniform plexus. Absolutely, good job. Here is the urethra. This is very obvious. This is the glands, or the head of the penis. And again, we talked about this in lecture, the male sexual response. I want you guys to remember the 4 different stages, knowing that excitement occurs first. Then you have the orgasm, you have the emission stage, you have the expulsion stage, and then you have resolution. So again, knowing these 4 stages is going to be very important for examination purposes. Excitement is the first phase, resolution is the 4th phase, orgasm being emission and expulsion. What I think is important for the excitement stage is going to be vasodilation, or this widening of the arterial supply. Again, this is how Viagra helps to get excited. This is going to increase blood supply. And engorgement just means to make bigger, then the penis becomes erect. And again, the body is preparing you for intercourse. So what happens? The bulbourethral glands, which is just an accessory sex gland, is going to produce this fluid. Here's the emission stage, and again, this is going to be where movement, peristaltic contractions begins occurring due to the vas deferens. This is going to move the sperm, this emission movement, and again, seminal vesicles are beginning to secrete fluid because why? The body's preparing you for ejaculation. This is the expulsion stage. This is when prostate again is going to continue to release secretions. What I think is kind of note here, this is kind of, if you think about it, makes sense. The internal urethral sphincter contracts. So the internal urethral sphincter contracts, which prevents urine from leaking out. Again, this makes sense. During intercourse, it wouldn't be very good if you begin urinating, right? This would be failure of the internal urethral sphincter. So there was a second point that I would argue that would be important, it would be that contraction of the internal urethral sphincter occurs during the expulsion stage of orgasm. Just something that you might want to make note of. And again, resolution. You're finished. The penis becomes flaccid, right? Remember, we had this vasodilation, increasing blood supply coming in to the penis. Now the internal pudendal artery has no reason to be vasodilated, so therefore it's going to constrict. Contraception, condoms. Are condoms 100% effective? No. What I do want you to know is that they are 100%. I won't say 100%. I don't know if anything ever is 100%, but they are protective against STIs or STDs and HIV. That's the one contraceptive form that is protective against STIs and HIV. I would know that for examination purposes. Here I've listed, Professor Hackney has listed some pros and cons. Again, the pros, the one I think is the most important, preventative against STIs and AIDS transmission. Very important. Here's your cons list. Male infertility. Let's begin talking about that. Um, I want you guys to know abnormally high scrotal temperatures. The scrotum actually perverts um, a little bit cooler of a temperature. This allows the um, sperm to survive much better. They survive better at lower temperatures as the temperature inside of the scrotum increases, and it can be due to any of these reasons. This could cause an increase in or a decrease in fertility. So the use of tidy whitey briefs. Why? Because um, the scrotum is not able to cool itself as easier. Hot tub usage makes sense. Also, heated seats within cars. High fever is not exactly sure. Testicular torsion. Testicular torsion can occur, and this can damage the vas deferens, and it can also compromise the blood supply going into that testy. Remember the testicular vein and the testicular artery carrying hormones, carrying blood supply, carrying testosterone to this testy area. This could definitely affect it. What about chromosome or undescended testes? This is something I talked about in lecture. Undescended testicles, again, the testes are going to form within the abdomen and they're going to begin their migration through something called the gubernaculum. Uh, Again, they arise, their primitive origin is going to be within the abdomen and they begin to migrate down. I told you guys that the abdomen has a little bit higher body temperature than the scrotum itself. So if a testy is undescended into the scrotum, then there's increased risk of two things. One is testicular cancer, right? Undescended testes have an increased risk of testicular cancer, but also we worry about infertility. We worry about infertility after the age of, I believe it's 6 months. I want to say if kids haven't had a descent of the testes within 6 months, then usually we do surgical correction. I could be wrong. Um, but again, it's just due to this increase in temperature that causes um, a decrease in the virility of the sperm. Chromosomal disorders, primarily, we're going to talk about one called Klinefelter syndrome. Um, we will discuss that on this next slide. Klinefelter syndrome, this is due to meiotic non-disjunction. What did I say meiotic non-disjunction was during lecture? That's right, it's when the gametes don't separate correctly. This occurs and allows inheritance of an extra X chromosome for the male. He has a Y, so therefore he does have the Y um, portion making him a male, but he also inherits an extra X, right? XXY. Um, of note, infertility is very common. I told you guys about the gentleman that I knew who had underdevelopment of the vas deferens. He was able to have a surgical procedure in which increased his chances of conception. That's really all that we will discuss regarding Klinefelter syndrome. I want you to know that Klinefelter syndrome is due to meiotic non-disjunction. It's due to inheritance of an extra X chromosome, and that it's a cause of infertility. I won't get into anything more than that. Male health concerns. When should I see a doctor? Again, I told you that one of the demographics for testicular cancer is in the very young. So check yourselves, guys. Here is a testicular self-examination guide showing you the different structures and how you should examine. The reason we examine is because if you find any lumps in your testicle or groin, or if you have pain, this might be a reason to see a physician. Again, if you notice any skin sores, bumps, or changes in your genitals, you worry about STIs, burning or pain, STIs, UTI, things like that. You notice a drip or discharge, again, gonorrhea, chlamydia, or things that pop to mind. Testicles ache or feel sore or painful. You experience pain or sex. If you were having sex with more than one partner, get checked for an STI every 6 months. Prostate exam, again, I showed you the relationship of the rectum in regards to the prostate. This picture right here will show you a very good demonstration of this. You have the patient come in, you ask them to, they bend over the table, you have a glove that is lubricated. The patient bends over and you ask them to bear down, and again, this is kind of how the procedure goes. We do this, the prostate exam, I don't know exactly how sensitive it is. I know in recent years we've been using something called the PSA, the prostatic specific antigen. This is been widely used to detect um, prostate cancer, but again, here, uh, prostate cancer likes to occur in the periphery, in the peripheral zone out here. So there's nodules that can pop up here, and you begin to feel those nodules, and this might prompt somebody to the occurrence of um, prostate cancer. Here's some helpful links. Again, thank you for coming into the second portion of the lecture. If you have any questions, feel free to reach out to me. I appreciate you guys.